82% of all visitors to a dental website will be female. And it will be mom.
Yeah.
She's looking for herself, she's looking for her husband, she's looking for her kids, her mother, her aunt, her sister. And one of the most important things for mom is trust.
Mm-hmm, mm-hmm.
And the best way to build trust, she won't read all 188 reviews, she'll read about 10 of them.
Yeah.
Good.
Yeah, as long as they're there.
But
yeah.
you know, some of the things that patients say on those reviews are so blatantly over the top that you couldn't say that yourself. I mean, go read ours. I mean, you know, it'll say, I used to be terrified of going to the dentist, and now my whole life has changed because of seeing Dr. Nielsen.
Yeah.
You know, you can't
Yeah.
say that yourself.
Yeah.
You know, first of all, most doctors are not, you know, that self-promotional. But even if they were, it would fall on deaf ears.
Mm-hmm.
But if the patient says it, it's a whole different.
So you do have morning huddle
Everyone.
every morning. How long does it take?
It's a 5 to 7 minute meeting.
Okay.
5 to 7.
What do you guys usually cover?
Before I tell you that, let me tell you that if some crazy rule happened, this is crazy,
Mm-hmm.
and some rule came down that says you cannot have a morning huddle in your dental practice anymore, that's crazy, but let's say that happened.
Right.
I would sell my practice. I feel that strongly about it.
Mm-hmm.
Because you either huddle and you plan for your day, or you muddle through it.
Mm-hmm.
And most practices muddle through it. I wrote an article for Dental Economics titled Huddle or Muddle, and I've learned that it's the most reprinted article ever published in Dental Economics.
We should reprint it too.
So it's called Huddle or Muddle.
Yep.
And I really believe you huddle. So what we do is we start with our hygiene schedule, and each hygienist very briefly goes through each patient. We identify who needs x-rays, we identify pending treatment, we identify anything unusual with each patient. It takes, you know, for each hygienist, less than a minute to go through their schedule. So we go through all three. Then we do the same thing with the doctor's schedule. That takes us to about 4 minutes. Then we talk about, we identify a morning and an afternoon emergency slot. So we identify that ahead of time. And let's say Paul's looking at 10 o'clock in the morning and 3 in the afternoon.
Mm-hmm.
Then if we happen to get an emergency and we come back in and write in on the schedule, the whole team knows that we've already planned for that. And so no one's upset about it. We've already planned for it.
Yep.
You know. The other thing we do is, because our doctor's time is very precious, in Arizona, hygienists can anesthetize. So we'll identify where Paul needs help. And on any given day, our hygienist might be giving about half of the shots, which helps us because then the doctor can be in another room.
Mm-hmm.
And everything flows very smoothly. And our hygienists give painless injections. So literally,
No, you can't.
you would look forward to getting a shot because you don't feel it.
Mm-hmm.
You know. So, and then we finish with a quote of the day, some positive thought about the day. And one more thing, the final thing we do, this is really important. We look at the schedule, and it's up on the screen. You saw the 6 days plasma.
Mm-hmm.
And we ask ourselves, we ask the team this question: whose life are we going to change today?